What's up everybody, Dr. Rossi, StrengsandSneakers.com. In this video, I'm going to answer a question that was posed to me recently about a medication called Acamprosate. So now's a great time to just go through Acamprosate and talk a little bit about this medication. It's also known as Campril. And first I'll start by saying that it's a medication that we actually don't use all that much in the United States. A lot of times we use other medications, and I'm going to talk about what the actual FDA approval is for Acamprosate and a little bit about what this particular person was asking me to comment on. So, Acamprosate is actually FDA approved for the maintenance of alcohol abstinence, right? So this is a medication primarily used to treat alcohol use disorder. That's the main indication. Actually, that's the only indication as far as I was able to find in my research. Now, what is the mechanism of action, and why might this particular person who asked this question have thought about this as a potential mechanism that could help with other things? So theoretically, the mechanism of action is a glutamate is that it reduces the excitatory glutamate neurotransmission. So it reduces glutamate activity. And you don't have to know this stuff, but I'll just throw it out there if it's helpful. Glutamate is the major excitatory neurotransmitter in the brain. So glutamate, major excitatory neurotransmitter. So what you're going to be doing here is you're going to be damping down that glutamate response in the brain. And this medication also has the added benefit of increasing the inhibitory effects of GABA. So this is going to be bringing everything down, right? That's sort of the idea behind it. It binds to and blocks these glutamate receptors and induces some of the metabotropic glutamate receptors, and also because withdrawal of alcohol following chronic administration can lead to excessive glutamate activity and deficient GABA activity. This is why we think it's good for alcohol use disorder. So if you think about this, someone's using alcohol on a regular basis, what can end up happening is when the alcohol is withdrawn or they're trying to abstain from it, they have this increase in glutamate activity that we want to dampen down with this medication. And we also have a deficiency in GABA because, think about it, alcohol kind of works like GABA in a way. It's an inhibitor. It sort of brings things down. So we might have a reduced GABA activity. So Acamprosate, of course, is going to deal with both of those things. It's going to reduce the glutamate excitatory effect, and it's going to increase the inhibitory GABA effect, and hopefully this will prevent things from worsening for that person with alcohol use disorder. Now, the doses of this medication are weird, and this is one of the reasons why some people suspect they're superstitious about using it, and that is it's 666 milligrams 3 times a day for those people over 60 kilograms, or 666 milligrams 2 times per day for those less than 60 kilograms. Two things to point out here: it's 3 times daily dosing or 2 times daily dosing, which I've talked about in the past as being difficult to follow. So people have trouble following those kind of medication regimens. The tabs come as 333 milligram tabs. And basically what you should do is probably recommend the dose initially at 666 milligrams 3 times daily, and titration is actually not required. So you just start at the proper dose without needing to titrate up, which is different than what we do in most cases with other medications. Now, the patient should have achieved abstinence from alcohol. You don't want to give this to the person when they're still using alcohol, so they have to be free of alcohol when you're doing this, and you want to be careful with patients that you might think may continue drinking despite treatment. So make sure you watch out for that. The notable side effects are diarrhea, nausea, anxiety, and depression. And now I want to get to the point that I was asked about and to comment on. And that was the thought of using this medication to somehow help curtail suicidal behaviors or parasuicidal behaviors, as well as to help to reduce self-harm. So could this medication in some way help people to reduce urges for self-harm? Now, in my research, I went on PubMed, I went through the articles. I honestly could not find any research indicating any benefit of Acamprosate in terms of reducing suicidality And I've talked about in another video I'm releasing today about lithium and lithium's ability to reduce suicidality as well as completed suicide. So I think, options like that obviously might be a better choice if that's one of the primary concerns or one of the primary symptoms that a patient is dealing with. And I'm going to point out that acamprosate actually has the risk of increasing suicidal ideation and behavior. So this can actually make suicidality worse. So anyone who's dealing with self-injurious behavior, suicidal ideation, has a history of suicide attempts, I would avoid this medication in those people for those reasons. So I don't really think there's much evidence to support the idea that this may help to curtail those cravings or urges to self-harm. Now, if I was getting fancy and you were asking me off the cuff to kind of give something that may help with urges like that, let's say self-harm urges, I would say naltrexone or Vivitrol, right? And the reason I say naltrexone or Vivitrol is because there actually is some data for that already in dealing with impulsive acts, things like gambling. So there's actually some research indicating that naltrexone might be effective in gambling, and obviously we know we use naltrexone to help curb alcohol cravings and reduce the number of heavy drinking days for people with alcohol use disorder. And we also know that naltrexone is very helpful for opioid use disorder as well, and can be used as a type of medication in that case. So both of those cases, if we're thinking about it from an addictive kind of framework, let's say, we're thinking about these self-injurious behaviors as a form of almost addiction, then maybe something like naltrexone would offer some relief to a person dealing with those symptoms. But again, I would probably avoid this medication, acamprosate, because I don't think there's any real data indicating any benefit in those cases. And also, I think that risk of suicidality or increased suicide risk with the medication and knowing that that's part of the product label is going to put you at risk for liability in prescribing this drug. So unfortunately, I wish I had better news for that person that asked the question, but ultimately that is my take on this medication. And again, I would use something like naltrexone in place and give that a shot to deal with these type of intrusive thoughts or impulsivity. There are other medications which I can go over in a future video that help to kind of reduce impulsivity, but also lithium I think is another medication to consider in the case of suicide risk. With that said, hopefully this video is helpful. Hopefully this clarifies a couple of the things, and if you have other questions and comments, please drop them below. I'll be happy to try and answer them.